Welcome, I'm Dr. Melina Roberts, and I want to talk about intravenous vitamin therapy. So this is administering vitamins and minerals through the venous system directly into the circulatory system, and there's lots of benefits to this therapy. And one of the big ones is that we can get a high absorption of nutrients and minerals right into the cells. And this can be very beneficial for a number of populations of people who have different issues, and these vitamin IVs can be very beneficial to these certain populations of people. Now, when we administer these vitamins and minerals right into the circulatory system, we can get a rapid therapeutic effect. And the way this can happen is that we have a high concentration of these nutrients and minerals in the extracellular space. And what happens is that it really helps to drive all of these nutrients and minerals into the cells through the concentration gradient. And so this is one huge benefit of doing IV vitamin therapy. Now, a lot of people will say, well, what's the difference between me taking vitamins and minerals orally and me doing this intravenously? Now, when you take any sort of mineral or nutrient orally, it first needs to be metabolized, it needs to be broken down by the digestive tract, then it has to be absorbed by the small intestines, then it's metabolized by the liver, and then it can make its way to certain cells and help to support those cells. But the challenge is that every step needs to be functioning optimally in order for us to get that nutrient into the cell. Now, the advantage of doing vitamin IV therapy is that we bypass that whole digestive tract and go right into the circulatory system. So this is a therapy that can actually be very beneficial to those individuals who have compromised digestive tracts. So this can be people who have ulcerative colitis, Crohn's, IBS, but it can also be for anyone who has chronic disease, including cancer, because what will happen is that if their digestive tract is compromised, then they can't effectively absorb the nutrients that they need in order for their body to properly heal. So this is a key factor of the vitamin IV therapy, is that we can get the key nutrients into their body and help their body to be able to heal. And once we can elicit that healing response, then we can actually start to heal the digestive tract, because that can kind of be your catch-22, is that how can we properly heal the digestive tract if we can't even get nutrients into the body? So this is one key factor, is that when we bypass the digestive tract, get the proper nutrients in, then we can allow the body to do the healing. Another advantage for doing the IV therapies is that it has a high amount of vitamin C in it. And vitamin C is a nutrient that's really essential in the body, but it isn't manufactured by the body. It actually has to be absorbed either from diet or supplements. And if we don't have a high amount of vitamin C, this can deplete a number of different functions in the body. One of these main ones is if we look at the adrenal gland. Now, the adrenal gland, the most abundant vitamin that it needs is vitamin C. It also needs vitamin B and zinc and magnesium. And that's what our vitamin IVs have within them. They have a high dose of vitamin C. It has all of your B vitamins and minerals, including zinc, magnesium, selenium. And The thing is that if you look at the needs of your adrenal glands, now your adrenal glands, they play a really important role in helping your body to be able to heal itself. Now those adrenal glands are often depleted because of a number of different stresses in the body and internally and externally that will drain those adrenal functions. And when those adrenals are drained, that means that it makes it hard for our body to be able to heal itself. So one of the ways that we can support adrenal function is by giving it the right nutrients in order to help build it up. And those nutrients that the adrenals need are vitamin C, B, zinc, magnesium. And so when we give the body those nutrients, we can actually be feeding those adrenals. So this is another population of people who can really benefit from vitamin IVs are those who have depleted adrenals. So depleted adrenal function, anyone with chronic fatigue, if you have a weakened immune system, if you have chronic inflammation in the body. So this can give you some insight into how this therapy can be very beneficial to a number of different populations. This can be very beneficial to anyone who has any sort of digestive issues in terms of a compromised digestive tract, and they're just not able to properly absorb the nutrients from the foods they're eating or the supplements that they're taking in order for their body to properly heal. So we can bypass the digestive tract and get it right into the circulatory system. And it can also be for those population of people who have a lowered adrenal function, and then we can give the body all of the nutrients it needs in order to help build up those adrenals. And when those adrenals are strong, it allows the body to be able to heal itself. And so this is a therapy that can be beneficial to a number of people. And I think that if you fall into any of these populations or you think you might benefit from vitamin IV therapy, then I would look into someone who is licensed and who has the proper training to administer vitamin IV therapy safely. So thank you so much for listening. I encourage you to share this with your friends, to press the like button, to make a comment below, and until next time, continue to learn, grow, and build health.